Hi, and welcome to my Borderpolar podcast. Today, I want to talk about something that's not necessarily fun to discuss. I want to talk about understanding and managing self injury. Self injury, also known as self harm, self mutilation, or sometimes just simply as cutting, is any intentional injury to one's own body. It doesn't always, but it usually leaves marks or causes tissue damage, sometimes leaving scars. Most of the people who engage in self-injury act alone rather than in groups. Most people attempt to hide their behavior. And it's important to note that self-injury itself is not the same as suicidal behavior. Now, self-injury is a hot button topic when it comes to these online support groups. Unfortunately, some people perceive it as um, a fad, and they think that if you post information or if you post about self-harm, that it's going to increase self-harm in others in some way or another. But I think talking about self-harm is important. Um, if we look at things that people can do to self-harm, self-injury, self-harm, self-injury can involve things like cutting, burning or branding, excessive body piercing or excessive tattooing, picking at the skin or reopening wounds, hair pulling, which is also called trichotillomania, head banging, and that could be against your own hand or against a wall or some other object, hitting oneself with a fist, a hammer, or some other object, and then bone breaking in some severe cases. It's important to note that um, there is no statistical difference necessarily between age, race, sexual orientation, gender, things like that overall when it comes to self-injury behavior. But it does occur most often among adolescent females and people who fit the following descriptions: people who have a history of physical, emotional, or sexual abuse, people who have coexisting problems of substance abuse, obsessive compulsive disorder, or eating disorders, also borderline personality disorder. We'll look into a few other disorders that self-injury may be symptomatic of a little bit further on. It may occur among individuals who were raised in families that discouraged expressions of anger, or individuals who lack the skills to express their emotions and lack a good social support network. Now, keep in mind that these are just um, cases where it occurs most often, but it doesn't describe everyone who might exhibit self-injury behavior. What types of things can lead to self-injury? Self-injury can happen when people face what seems like overwhelming or distressing feelings. It can happen sort of as an act of rebellion, um, as a rejection of parents' values, a way of individualizing oneself. And most often it may be a reflection of a person's self-hatred, either punishing themselves for having strong feelings that they were usually not allowed to express when they were children, or punishing themselves for somehow being bad or undeserving. Self-injury can be a way to temporarily relieve intense feelings, intense pressure, or intense anxiety. It might it might serve to help someone control and manage pain, unlike the pain that's experienced through physical or sexual abuse or trauma. That pain can't be controlled by the individual. It may serve to provide a way to break through emotional numbness. Um, Some people can cut without feeling pain through a sort of self-anesthesia. It may serve as a plea for help in an indirect way by drawing attention to the need for help. Or it may serve to attempt to affect others by manipulating them, either to try to make them care about what's going on, try to make them feel guilty, or try to make them go away. And this might be unintentional manipulation as well. Some symptoms of self-injury include frequent cuts and burns that cannot be explained, self-punching or scratching, needle sticking, head banging, eye pressing, finger or arm biting, pulling out one's hair, picking at one's skin. I'm going to be talking about my own journey with self-harm a little bit later in some of these slides, but I can remember at my youngest, I mean, I've been biting my fingers as far as I can remember. I remember headbanging as young as 7. Um, I remember um, harming myself by digging pens into my legs as young as 3rd grade. Um, I remember wringing my arms in a twist um, as young as 3rd grade. I remember um, well, I'll get a little bit further into this, but these are just some symptoms that you might notice if someone is self-injuring. Warning signs of self-injury can include wearing of pants and long sleeves in warm weather if someone's trying to hide scratches or cuts on their arms or burns or something. If you notice lighters, razors, or sharp objects on a person who normally wouldn't be having those types of things on them, um, very low self-esteem, someone with difficulty handling their emotions, their feelings, someone exhibiting a lot of relationship problems or problems functioning at work, at school, or at home are some warning signs. Now, these are also warning signs, these last 4 are warning signs of depression. And, a lot of times when people are self-injuring, they are depressed. Um, but these are just some things to look for. Now, I mentioned earlier how self-injury can be symptomatic of some illnesses. So here's a list, and this is not all inclusive, but personality disorders, particularly BPD, borderline personality disorders, substance use disorders, bipolar disorder. So we have both bipolar and BPD on this list here. Major depressive disorder, anxiety disorders, particularly obsessive compulsive disorder, and then also schizophrenia is on this list. Now I used mainly Mayo Clinic, I believe, or maybe it was WebMD. I'll see at the end for my reference for the information in the slide. I'm sure that there's more disorders where that's a symptom, but those are just some things that doctors might look into. If they're seeing self-injury behavior, they might look at other symptoms in conjunction with the self-injury behavior to see if they can help someone by treating them if they have a diagnosis of one of those illnesses. So treating self-injury in a psychological setting, you would use psychotherapy, such as CBT or DBT, dialectical behavior therapy. There's post-traumatic stress therapies that are going to focus on handling the triggers so that your feelings don't get quite so intense. And then group therapy and family therapy are both good for figuring out how you handle dynamics with other people and what your family can do to um, help you as well. And then there's hypnosis and self-relaxation techniques, which is more of a preventative measure because it's helping to reduce the stress and tension that will precede the incidence of self-injury. So sort of try to lessen those moments of high impulse and high intensity of emotion. And then there's also medications that can be taken to help with self-injury. Antidepressants, low-dose antipsychotics, or anti-anxiety medication that can be used to reduce that impulsiveness, that impulsivity, the initial impulse response to stress. I am prescribed a low-dose antipsychotic for my impulsive behavior and self-injury myself. I mean, I also have an anti-anxiety medication as well. The prognosis varies depending on a person's emotional or psychological state. It varies depending on how willing and open they are to try new things to um, combat the impulses and urges. And it varies depending on the nature of any underlying psychiatric condition that they have. And so, looking at those it's symptomatic of any of those conditions. If you have BPD, if you have bipolar, if you have schizophrenia, if you have OCD, if you have any of these disorders and you're self-injuring and you're not taking the steps that you need to take towards managing your disorder, then your prognosis isn't going to be nearly as good as it would be if you were. And that's pretty much the same with any mental health disorder and any type of symptom that you could be dealing with. It is important to note the following. You need to be able to determine the factors that lead to the self-injuring behavior. Those triggers are going to be important to note, and figuring out how to handle those triggers in a more productive way. And then also being able to identify and treat any pre-existing personality disorders. So talking about the PD here, or any other personality disorders that might be underlying the symptom of self-injury. Um, Treating those disorders is essential to managing that behavior. So I want to talk a little bit about defeating self-injury and self-love, and then I'm going to talk a little bit about my journey myself. Um, I have found that uh, the only way for me to combat self-injurious behavior is by practicing, and I mean practicing, self-compassion, self-care, and self-love. Therapy helps, medication helps, all those things help. But even on medication and in therapy, um, I still had urges and I still followed through. And um, the more I practice self-compassion, self-care, and self-love, the easier it is for me to get through those impulses when they happen. Let's look at some myths and truths about self-love that I found on a website here. I have all my resources listed at the end. So the first myth says self-love is a new age concept brought forward through selfies and social media. But the truth is self-love has been around since ancient Greek philosophy around 350 BC. And that can be traced back to Aristotle and his teachings about how one must love oneself. And not only that, but one must love oneself first in order to be able to love others. And I know a lot of people find that phrase to be off-putting, but I believe it to be true because you can't truly love others unconditionally if you don't love yourself unconditionally first. I really do believe that. And that's not to say that there's a flaw in you if you don't love yourself. It just means that, um, and it's not easy to love yourself. It just means that you need to keep working on it if you want to be vulnerable enough to be open enough to love others. So the second myth is that self-love makes you selfish, narcissistic, or arrogant. And so a lot of people, I think, feel this kind of guilt when they try to focus on self-compassion, self-care, and self-love. They feel guilty because it feels like they're being selfish, but that's not true. Self-love makes you more positive, more confident, and resilient. And in reality, that's going to make you a more helpful human being for everyone around you. Another myth is that there's no science behind self-love. And there are many concepts, especially in positive psychology. And if you're not familiar with positive psychology, I suggest you look into it. It's a very interesting concept. And uh, there is, you're going to find evidence between positive thinking and benef benefits in the brain. I will be touching more on things like that in my Navigating Your Brain video, um, and how neurotransmitters have an effect on mood. The next myth is self-love is basically self-care. And the truth is that self-care is just one form of self-love. And we'll touch on that a little bit more in a little bit here. And then the next myth is that self-love is about showing to the world that you love yourself. And I think that ties back to sort of the first myth where it talked about selfies and everything like that. And I don't I don't believe that's true. I believe self-love is just about believing in yourself and treating yourself with love, and this false image that people might put out to the world on social media to get attention is not the same as self-love. That's something different. Self-love has a lot more to do with you and your relationship with you, and that has nothing to do with what you put out there to the world. So, self-love is a state of appreciation for yourself. It grows from the actions that you put forth that support your physical, psychological, and spiritual growth, the things that you do. Self-love is having a high regard for your own well-being and your own happiness, the same way that you would for someone else that you love. Self-love is taking care of your own needs and not sacrificing your well-being to please others. It's wonderful to think about others, but you shouldn't sacrifice your own well-being to please other people. Now, I'm not talking about, a mother going without in order for her child to eat. I mean, we all know we're going to give to our kids first, but we've all been in situations where we've found ourselves sacrificing our boundaries, or sacrificing what's really good for us just to make someone else happy when it wasn't a necessity, it wasn't a life or death situation, but it wasn't self-love. Self-love is accepting yourself as you are in this very moment for everything that you are. And we can't really do that if we're still angry or hung up on things in our past. We sort of have to accept everything that's happened because it's made us who we are today. And the only way we can accept ourselves who we are today is if we accept everything we've been through. And that's a big ask. And that's mindfulness, accepting yourself, accepting the moment for what it is. And then self-love is accepting your emotions for what they are and putting your physical, emotional, and mental well-being first. And again, you might end up feeling selfish about doing these things, but it really is the pathway to peace. What can self-love look like? Self-love can look like talking to yourself and about yourself with love, and that might feel weird for people who aren't used to being self-compassionate or practicing self-love. It would look like prioritizing yourself, giving yourself a break from self-judgment, trusting yourself. Now, these are not always easy things to do, so just because I'm saying them don't make it seem like it's easy. Self-love can look like being true to yourself, being nice to yourself. Now, it's easy to do these things for other people, to be nice to other people, to be true to other people, to talk about others with love, but try turning these things around on yourself. Try turning them around on you. Treat yourself like you would treat others. Setting healthy boundaries. And one of the most important ones, I think, forgiving yourself when you aren't being true or nice to yourself. Don't be too hard on yourself. Self-love is about self-compassion, and self-compassion is about forgiving yourself when it's not going okay. How do we practice self-love? And I mean practice. This is something you have to consciously do if you have trouble with it. You have to take the time every day to make a point of loving yourself. Sort of like if you have children and you're sure that you tell them that you love them every day. Make sure you remind yourself too. I mean, that's important. So be aware of how you talk to yourself. If you hear that as negative thoughts coming into your mind, for me, Um, my self-harm manifests itself sometimes where I'll just be laying there and I'll just hear the words punch yourself. Like I'm saying it to myself in my own brain, punch yourself. And it doesn't make any sense, but that's my disorder, and so I choose an opposite to emotion action and I get up and I go do something else, but I don't stay there in that moment if I feel like I shouldn't. And I'm aware of the fact that it happens, and I try to be kind in the next moment. So be kind towards your body. Um, Learn to receive compliments with grace. This is a really hard one. I started cognitive behavior therapy back in 2009, 2010, and one of the things I had a really hard time with was compliments. And my therapist worked with me for a long time on simply saying thank you when someone said something nice. I would usually just argue with them. They would say, "Oh, this is really great." Well, no, it could have been better. I didn't do this, or, "You look really nice." Well, no, because da da da. Whatever it was, I would just argue with them, and so we practiced, and I would practice just saying thank you. So learn to receive compliments with grace. You may not always agree with what the person is telling you, but accept that they believe it and just say thank you. Take breaks from work or school or whatever it is you're doing. Move and stretch. That's good for your body, Move with a purpose, stretch your body, do good things for you. Put your phone down, connect to yourself, connect to others around you, or do something creative. Even if you have to push yourself to do it, you will feel better afterwards. Become mindful, accepting those moments for what they are without judgment, focusing on what it is you're doing and paying attention and moving with a purpose and being aware of your feelings and your emotions and the sensations going on inside your body, the things going on around. Taking actions based on need rather than want. So thinking about what your body needs and what your spirit needs and what your mental health needs are at the moment rather than what your impulses might be telling you. Um, Sort of like you would if you were standing next to yourself and watching yourself make decisions, So I'm hungry, but um, I don't feel like cooking, and I'm gonna go drink some coffee instead. And you were staying next to yourself and you'd say, no, 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 coffee's not food. If you're hungry, eat something, talk to yourself, think about yourself the way you would if you were caring for someone else. And focus on what you need rather than what you want in that moment. Practicing good self-care. Good self-care includes things like personal hygiene, what you put into your body, making sure that you work your body, um, things like that. Make room for healthy habits. And if you don't know where to start by being kind, patient, gentle, and compassionate with yourself, the same way you would with someone else that you care about. If you think about it in that way and you try to practice it in that way, it might be awkward at first, but it becomes easier to practice self-love if you think about sort of treating yourself as a patient. You're a mental health patient and you need certain levels of care, and that's okay. So, I want to talk a little bit about my journey with self-harm and how I've gotten over it in various points in my life and how I'm dealing with it at the moment. What I have here is a meme that I created for my Borderpolar podcast that says, "You are enough." I put this out at one point for just a post that I wanted to make, but I want you to draw notice to this portion right here. If you notice right here on my wrist is a rubber band. Um, my very last bout with self-harm ended about 2 months ago, maybe, um, shortly before um, I turned 40 years old. And it lasted for several months, and it was rough, and most, it was unexpected because the last time that I really dealt with self-harm was when I was in my early 20s. And, since my early 20s, between my early 20s and this last year, um, I have had moments of I've had constant finger biting, and I've had moments of hair pulling, and I've had moments of um, slapping. Very, very few and far in between moments, maybe like a few every year, but never a pattern or behavior that became a problem until last year. But in my early 20s, it was an issue, and in my teens, it was an issue. And when I was young, it was a pattern, but it wasn't, I never left marks. It was just patterns of behavior for how I dealt with my emotions. Well, this last bout was worse than any of the others because I found myself scratching at my thighs and at my arms and leaving bloody marks, and bruising, and I couldn't stop myself. And so what I started doing was wearing this rubber band on my wrist. And that's what you can see in that picture. I wore a rubber band on my wrist for several months. And then I got a tattoo on my arm here. You can see, oh, oh, if I can do it, on my arm here, there, on my arm. Here's a picture of it. It's an anchor. Um, Prior to the self-harming, I had decided that I wanted to get an anchor tattoo to help me to anchor in my breath. Actually, I don't think it was prior to that. It might have been in the middle of it. Yes, I think it was. It was in the middle of it. To remind me to anchor in my breath and to ground me and to replace the rubber band. Um, and I haven't self-harmed since I've had the tattoo. Um, and the rubber band did a great job prior to that. It wasn't perfect, but it was about 86% foolproof. Um, I was able to flick it when I had an urge. Um, and I think only twice did I ever flick it in pain, like to harm myself, which I know is against the rules. If you're going to use a rubber band, you don't flick it to harm yourself, you flick it to suppress the urge. Um, when I was, so that's the self harm that I was going through um, most recently, which I did end up putting myself in the hospital for a few days during that bout of self harm. In my early 20s, I was also hospitalized when I was self harming. At that point, I was burning myself on my toes with a lighter, mostly, among other things, the little behavior things that I always would do, um, like the finger biting and digging nails in, um, some head banging, hair pulling, little things like that. But I never was a cutter. I never had the stomach for that sort of thing, but I thought about it. I had the urge lots of times. I still do. Um, I take medicine for the impulse control every day, and then I have an as needed dosage I can take if I'm having my impulses are too out of whack one day. I do still have the urge. I just sort of rub my tattoo when I get it now, rub my tattoo, um, and that seems to work for me. I've heard other types of ways for people to cope with it by saying drawing on their body with marker where they would cut, even getting so intricate as drawing wounds. Um, but it's a difficult urge to deal with, and I'm going to share a little bit of my coping mechanisms that I use in general in daily living that help me to cope with self-harm urges as well. Um, when I was 14, when I was a teenager, um, I was also suicidal at the time. Um, but I would self-harm a lot back then, and that was a lot of head banging and hair pulling and digging pens and various things like that into my legs. Um, but this last bout, when I was almost 40 years old, I just decided I've had enough of this being a part of my life. Um, and this anchor is a reminder for me that I have control over this aspect of my life. I may not be able to control the urges that come to my body, like the urge that comes in. I can't control the fact that it's there, but I choose what I do with it. And I choose to focus on this and give it a little attention and let it go, because that's not what I'm going to do anymore, because I choose to treat myself with compassion, and I choose to treat myself with care, and I choose to treat myself with love. And one of these days, those feelings are going to follow. I'm going to really care about myself, and I'm really going to love myself, because feelings follow actions. So I keep practicing. So um, here's a little bit about what I have used. So first of all, move with the purpose. Why is that helpful? Okay, for me, I have a lot of days where I feel, um, I don't want to do this on camera, but if you have this disorder, borderpolar, you'll probably understand exactly what I mean. There are just days where I feel like, you just feel like that on the inside, like everything just feels like that. But you have to sit like this and be normal with everything inside. It's just going, it's very difficult to pretend like everything is normal when on the inside it feels so crazy. So one of the things that I try to do is move with a purpose, and I consider that sort of like a part of mindfulness for me. And it started with me being doing yoga. I've done yoga on and off for about 15 years, never too consistently for too long. But over the last year, I've done it pretty consistently until I hurt my knee recently. And I find that I can't meditate, sit, and concentrate. I can't clear my brain that well, but moving with a purpose helps me to meditate a little bit. And if I do that throughout the day, and I concentrate on each thing I'm doing when I'm having an overwhelming moment, it helps me. So if it's just as simple as saying, let's say I'm brushing my teeth, and I just move very purposefully. Take the toothpaste in your hand, take the toothbrush in your hand, put the toothpaste on the toothbrush, and just every movement, just be very purposeful in your movement. And that gives you something to focus on. And it helps with mindfulness and being very in the moment and a little bit less out of your head. So moving with a purpose with everything I do when I need to focus on something other than what's going on in here is a really helpful tactic for me. I want to share a couple things before I move on. One is something called helping hands. Now, helping hands is simply placing a hand on your body. You can either put it here on your heart, here on your stomach, or sometimes I do both. So one hand on your heart, one hand on your stomach, or just one on your stomach, or just one on your heart when you're feeling overwhelming moments of anxiety, and making that connection with your body and breathing is an act of self-care in itself, and of self-love in itself. And it helps to connect your mind with your body and slow things down. And you'll find me in public having conversations with people, talking and talking, and I'll have my hand right here as I'm having a conversation, because I get anxious in public. And so if I'm using helping hands as I have a conversation, I can get through it better. So helping hands is a really good tactic that I use, just to keep my anxiety levels at bay. And what I use when I'm having those self-harm urges is kind of a self-soothe position, where you sort of rock and hug yourself. You might have your knees up, but getting really close to yourself and holding your body close to yourself. It's sort of a self-soothing kind of position that brings everything in and kind of centers you, and that might help you when you're feeling kind of chaotic in your movements and wanting to do things with your hands that you don't want to do, like harm yourself. A self massage. on your shoulders or on your feet, or on the back of your neck can be really helpful in high tension moments. And that's another form of self-care. You can use mindful breaths. Mindful breaths, to be very aware of the breath in, the breath out. Feel your diaphragm move up and down. Feel your lungs expand and contract. Be very mindful of your breaths for a couple of minutes. That can slow out all the processes going on in your body that are overwhelming if you're having anxiety or big urges. And then another thing I like to do, besides moving with a purpose and treating myself like a patient sometimes, is I like to take relaxing baths. Um, Especially if self-care is difficult for me, and it is oftentimes. I find baths easier than showers because showers feel like more self-care than a bath. Like, feels like you're doing almost more work. You still are washing and rinsing, you're still doing all the work, but the bath feels almost more like a treatment, like a prescription from the doctor, because you're sitting in the warm water and it's soothing, um, and you can get through it at whatever pace you need to. You might have to sit there for 25 minutes before you can get the strength to wash your hair, but that's okay, and I find that relaxing if I can't get through a shower. So, move with a purpose is one of the things that I try to use in order to cope with the stress that might lead to the impulses for self harm. This is a list of my mantras. Now, these first four are the ones that I repeat to myself over and over throughout the day, and especially in moments of high stress. You might find me repeating them to myself out loud sometimes when I'm walking around dealing with different things, because if I can do these four things, I can get through anything. That's the way I look at it. So, one breath at a time. Don't be too hard on yourself. And that has a lot to do with self-compassion and forgiving oneself for things that you maybe can't do yet or have done and wish you wouldn't have. Enjoy the happy moments when they come. Now, they might not feel like they come that often, but they do. And when they do, just soak them up. Treat others how you would like to be treated. And I should add to that, treat yourself how you would treat others. I might add that to that maybe, but and then these three things are important to keep in mind. The only thing you need to do today is try your best. As long as you do that every day, everything else is a bonus. So as long as you're trying your best, you can lay down at the end of the night and you can go to sleep with a clear conscience knowing that you did everything you could because you tried your best. The next one is, no matter what anybody thinks about you and your recovery and how well you're doing, only you know exactly how strong you are and exactly how much you can handle and what you can do. The next one is, speak your truth, even if your voice shakes. And that is important, especially because there's so many limitations to understanding when it comes to people knowing what it's like to live with a mental health disorder who don't have one themselves. So speak your truth, even if your voice shakes. So these are just some of the mantras that I like to sort of live by on a daily basis. And they help me also to not have my anxiety get quite so high, to those tension levels, those stress levels that might lead to the urges of self-harm. Not all the time does it work, but they help. So I try to keep those 7 things in mind. This is some self-coping thoughts that I try to think about, especially when I'm in those crisis moments. This too shall pass. I know that's difficult to imagine when you're having a crisis moment, but it will pass. It will. And sometimes counting gets you through it. I am strong enough. And only you know how strong you are, but you are strong enough to get through these moments. You are strong enough to get through these moments. You are strong enough to get through those moments. I am not in danger is something that I have to remind myself sometimes, especially if I'm having a PTSD trigger. I am a survivor. Remembering how strong you are and remembering what you've been through and what you've been able to overcome helps you to be able to overcome anything that you're facing at any given moment. And then my thoughts don't control me. I do. We don't get to decide what comes into our brains, but we do get to decide what we do with our bodies. And that is empowering. And the next two slides are a little bit more about self-love. And I want to talk about how we love. Now, I've heard the phrase before, um, after everything I've done for you. Um, I can't believe they would do this after everything I've done for them. Or you would think they'd be more grateful, or things like that. And a lot of these phrases to me don't feel like they go in hand with loving unconditionally. When you love anyone, including yourself, you want to try to do it wholeheartedly without expectations. You love because there's beauty in loving. You don't love because of what you're going to get in return. You don't love because it's going to get you some reward. You don't love because for any other reason than just to love. And if you can love with your whole heart without expectations in return, then that's pure love. And if you can turn that inwardly to yourself and not tell yourself that you have to be perfect or you have to be um, better, you have to be true to yourself. You need to be true to your values. That's important. But you don't have to be perfect. You're going to make mistakes, and it's okay to love yourself with your whole heart, even if you do make mistakes. But don't hold yourself to an expectation of perfection or anyone else. And then the last one, I think this is the last slide, is to truly love yourself is to love without expectation. So again, turning that around on yourself. So that pure love, loving without expectation, loving wholeheartedly, and then turning that in on yourself. It's not easy to do, but I truly believe that the best way to battle self-harm is to practice self-love. I really do. I have a list of references here. It was WebMD, it wasn't Mayo Clinic. So I have a WebMD reference for the self-injury information that you had on here today, and then the rest of it has to do with self-love. And these are just some articles that I had researched previously and that I used a little bit in this slideshow today from Psychology Today and some other references if you're interested. Um, I know this isn't an easy topic to talk about, but it's important and it's real and it's not exciting and it's not fun and it's not cool. It's terrible and frustrating and restricting, and I don't wish it on anybody, but we have to talk about it and we have to work at it so that it gets better. Thank you for joining me for my Border Polar podcast. Like and subscribe if you enjoy the content. If you think it would be helpful to anyone else, please feel free to share. I do have a Facebook page, my Borderpolar podcast on Facebook. And if you have a borderpolar diagnosis, I do have a private Facebook group that I'm trying to get some people to interact in for a support group of sorts. I hope this was helpful, informative, anything. Have a nice day.